So if you want to live longer and be into your hundreds, do something every day. And they say one of the best forms of exercise is to walk, because it's really good on your joints versus jogging. And then the fourth is eat a fiber-rich cereal for breakfast. Getting a serving of whole grains, especially in the morning, appears to help older folks maintain stable blood sugar levels throughout the course of the day. So if you want to go to, I think this is on HuffingtonPost.com, there are a few more ideas if you want to live to be 100. Did you like how we did that?
Magically appeared somewhere else.
We walked around. It's funny because there are all these cords on the ground, and I almost tripped yet again.
I would have caught you.
You would have been there for me. Just start without me.
Always there for you.
Appreciate that. Whether it's finding solutions for ADHD, providing help for those suffering from depression, or seeking cures for ailments like high blood pressure, many of the remedies that treat patients are discovered and tested through clinical trials.
And while those trials can be a benefit to many, they can also be met with apprehension by those who might be interested in participating, but might have misconceptions about what's involved. Now, that's where our next guest comes in. Susan Angel is here from CNS Healthcare, along with Mike Ryan, a local patient who's actually undergone a clinical trial, and he joins us to talk about his experience and what he found out through it. Thank you both for being here. Susan, again, it's good to see you.
Thank you for having us.
Absolutely. I'm going to get to you in 1 second. But Mike, tell us, what was it that made you make the call and make that first step?
Well, I started a company last year, Closed Gap Technologies. It's an IT recruiting firm, and I knew that it was going to take a lot of my time, a lot of focus, and a lot of dedication, and I had always suspected that not only did I suspect it, but everybody around me and everybody I'd ever come into contact with suspected that I had classic characteristics of ADHD. And I am a classic adult ADHD. And what happens is you go through your entire life with those characteristics and you just learn to live with them, and you don't think that there's really any option. I was apprehensive about going and diagnosing and medicating it, and heard on the radio about a clinical study being performed by CNS, a local company, and my wife insisted that because we had talked about it. I've got a 2-year-old, Imani and McCartney. He's my 5-year-old, and he always imitated and mimicked me every morning, and would always act like he had lost everything before he walked out the door, and all of the characteristics that an ADHD person might go through. And she insisted. She said, "I will drive you there. I will wait out in the parking lot, and I will make sure that you go in and at least have something to say. There is either an option or you'll have to live like this the rest of your life." Clinical study, yeah, a little apprehension, and clinical studies to me always kind of the guinea pig thing. Yeah. What an inviting environment it was. I mean, everybody, from the moment you walk in to the moment you actually go through the evaluation to determine whether or not you are ideal for a clinical study. That's important, because they have to go through an evaluation to determine if you're even the type of person that a clinical study would invite in to go through the process. And it was very thorough.
And what was the end result for you? How are you
Life-changing.
Life-changing.
Life-changing. I mean, ADHD is something that affects everybody in your life, especially if you have certain characteristics. And people don't run away from me when they see me coming anymore. And yeah,
and you take that personally or anything.
And you can't aren't mimicking you anymore, are they?
People are not mimicking the characteristics. I've got other things that are very, very easy to mimic and could bring some humor, but my son doesn't have any material to work from anymore, so he's got to come up with a different act. And my wife, I get a lot more kisses.
So Susan, why don't we bring you into this? Yeah. What happens during a typical visit?
Well, he mentioned the initial piece coming in, seeing if you're a good fit, and that's when you're meeting with the clinician. They're reviewing your symptoms, your health history, and then going over study details to see if it's a mesh. And if it is, then you move forward into the trial. And that's when you're able to get in, meet with the physician or myself and the clinical team, and you go through a process where they evaluate your entire history, looking at your symptoms, current symptoms, and then you go through laboratory testing, EKG, vital signs, those types of things to make sure that there's no excluding factors, and then you just move forward there. Typically weekly or bi-weekly visits, looking at the effectiveness of medications or new treatments.
Do you need insurance? How much does this cost?
Doesn't cost a thing. Don't need insurance, and in fact, if you qualify and enroll, we'll actually even give you a little stipend for participating. So it benefits you in numerous ways.
Now, aside from the ADHD trials that you have right now, are there any others that you have that are ongoing?
Certainly we have a trial going on for hypertension, for high blood pressure, bipolar disorder, depression, also pediatric population with ADHD, and also pediatric depression.
And would you do it again, Mike, if you felt the need to do something?
It's almost, I feel like I was kind of a martyr because I'm very vocal about having been through the ADHD experience my whole life. And it's amazing how many people I mentioned to that I had gone through a clinical study. And the first thing you find out is that either there's something that has affected them or somebody in their life or somebody in their family. And I'm always recommending, if it is that it falls underneath the CNS experience, that they go and talk to CNS and at least look at the options. So yeah, I would definitely go through it again.
Well, thank you, Mike.
Yeah.
And thank you so much, Susan, for being here. We appreciate both of you and want to thank CNS Healthcare for sponsoring this segment.
Indeed. To find out if the trials are right for you, you can call them at 904-281-5757 and make an appointment for a free 30-minute evaluation session. Or you can also log onto their website at cnshealthcare.com. Remember, all their services are free and no referral or insurance is needed.
All right. Well, whether you're looking for concerts from a classic songwriter or a, Daryl, say it, a
Massive
reggae band.
Yes.
Did I get that right? Is that how you're
It
supposed
sounded pretty good, man.
It's not the size. It's not large.
You don't have the dreadlocks still, man.
Oh, okay.
All right. Well, eye popping magic, MMA.